please feel free to call me. I'd love the opportunity to try to help you. The Dozier Law Firm, we're here in your time of need.
Pastors, the community is in need of a word. We need church. Bertice and Don are pastors, and they understand the budget of ministry. Yes, they have a budget-friendly price for your church to be aired on 107.9 FM and 980 AM WDDO. Call Vertice today and let's get your ministry broadcasting immediately. 678-800-3976. That's 678-800-3976. History repeats itself. The new dynamic duo, 107.9 FM and 980 AM WDDO, The Glory. Have you advertised your business or church services? Well, thousands of listeners are waiting to hear about you and your business. Call the advertising department of WDDO and let us be your avenue to greatness. Have you advertised your business or church services? Well, thousands of listeners are waiting to hear about you and your business. Call the advertising department of WDDO and let us be your avenue to greatness. Connecting the community through gospel. The new 107.9 FM, W300EB, Macon, and WDDO 980 AM, Perry, Macon.
The views expressed on this program are not necessarily the views of the Glory 980 AM, the Glory Media Group, LLC, WDDO AM, its staff, management, or advertisers, but are the views and opinions of the participants of the broadcast.
Welcome to the Issues of Life broadcast with your host, Evelyn Reid. This show will address health, religious, and political issues that our communities face daily. Let's go live into the studio with your host, Evelyn Reid, for the Issues of Life broadcast, right here on the Glory 107.9 FM.
And good afternoon and welcome to Issues of Life. I'm so glad you joined us today. I have a special guest coming in and I'm waiting for him to get here, but I just wanted to say that I'm so happy that you're here. And also, this is Easter weekend, the death, burial, and resurrection of our Lord. So we want to celebrate Jesus and what he did for us. And I'm so thankful for what he did for me. Um, because as I get older and learn more about what he did, I was thinking about him the other day and I was thinking to myself, wow, if Jesus took my sins on the cross, that is a lot. But then if he took all of our sins on the cross, boy, did he take a lot on him. And so we have so much to be thankful for what Jesus did for us. And the word of God is very clear. For God so loved the world that he gave his only begotten Son, that whoever believes in him should not perish, but have everlasting life. So we're excited about that. If you have any questions today, you can call us at 478-250-1444. We're going to be talking a lot today about the dentistry, and we're excited about that. And we're going to have Eric Hall coming in to be with us on the show. So anyway, if you have any questions, just give us a holler, and he should be here shortly. Um, in fact, he's on the phone now. So and I think my husband may have gave him the wrong address. So we're excited about him being here, and we're going to talk a lot about how important it is for your teeth and your health for um, for taking care of your health. I'm excited. Good afternoon, Miss Kimberly Houston. It's good to hear from you. We are delighted to hear from anybody that calls us. And if you want to do a show, you can give us a call here. We're going to be having some great people coming in. The people from Willow Tree is going to be here soon, and the Pink Awards, they're going to be here talking about how to dress and all the fashions that's coming. So we're excited about all of that. And we are excited, especially for this holiday season. You know, I was driving through some of our neighborhoods and everybody has things out for Easter, like the Easter bunny, the Easter eggs, the Easter trees and stuff. And I was thinking as I was driving past that, nobody has the cross, what Jesus did on the cross for us. He died on the cross for us. And it's so good to know what he did for us when he died on the cross for us. And it's so nice and good to know what he did for us. So, you know, we've been taking this class at our church on living of the happy life, and it's a class that's been presented to us by David Jeremiah, and it was telling us in Ephesians 1 what we are in Christ. He says he knew us before the foundation of the world, and he chose us. He chose us. He adopted us. He redeemed us. And when you think about all of that, how good God is that knowing that you've been uh, adopted, to know that you've been redeemed, to know that you are saved, and where you're going when you die. And so it takes the sting out of death for you. It takes the pain of losing a loved one, because when you know that that loved one is saved, it's a better deal for you. It's like, wow, I know where they're going. I know what they're all about. The sad part is if a person dies and don't know Jesus as their personal savior, that's another story. And it's a lot of pain associated with that, because if they did not accept Jesus as their savior, then it's only one place for them to go. However, we all want to think that our loved ones went to heaven and is rejoicing in the goodness and the glory of God. And so we're excited about that. We're excited that Easter is the favorite time of the year for me because it represents the day that Jesus set us free. And I want to talk to you too about some new research I've been doing in the health world. Um, I research every day, and I found so much new stuff that I really want to share. with my audience about cancer, about surviving cancer, not just cancer, but also surviving diabetes and all the other stuff that goes on with your body. A cleanse for liver, you can use milk thistle, that is very good for cleansing the liver. And all of us need to make sure that our liver is cleaned, because it's that the bile from the liver can cause problems with the pancreas and the stomach and all those other areas that go on in the body. So you really want to make sure you're doing that. And those of you who may have sores, like from diabetes or stuff going on with your feet, or sores that can't seem to get healed, you can use silver. That's pretty good at healing cuts and bruises and burns on your body. So you might want to do that. And those of you who are having a lot of swelling and you can't figure out what to do with that swelling, you need Venustat. Venustat takes, well, the other name for it is called a horsetail. But what it does, it takes the swelling out of your feet, and helps your body to, the blood to flow, or the circulations to go into your body, and help you out a lot with that. Those of you who are having high blood pressure problems, you might want to try drinking cocoa, just basic cocoa, no cream, no sugar, just drink it naturally. That will also stop an asthma attack. It would also stop COPD. When you can't, when your loved ones are going through COPD and they're having these coughing spells, just give them a cup of cocoa, and it will stop the COPD coughing right away. So it's really good to understand that and know that. The more you know, the better off you are. As I study, sometimes I think about how good God is, that He made everything for us. He gave it to us in the garden, but we don't like to. We don't like to say, I got that from the Bible, or I got that from that. But He said, I've given it to you. And you can live when you deal with what God has given us naturally. And I know that I'm a living witness of that. I have had cancer two times. I had lung cancer, and I wasn't a smoker, but I did have lung cancer. I'm 25 years since the lung cancer, and 29 years since my first cancer, no chemo. Now, if you are getting ready to have chemo, you need to think about soursop. Here in America, we call it gravioli. In the Caribbean and other parts of the world, they call it soursop. And what that is a natural chemo. So you need to know that before you go crazy and stuff with all the stuff that you're going through. So it's important that you know what you're doing with whatever you're doing. And I think my guest is here. And I'm so excited because we're going to be talking about a lot of stuff that's going to help you. How are you?
I'm doing well.
Good. And I'm happy to have you here because we're talking about natural stuff and also healing that you can deal with. I'm sorry, my husband must have given you the wrong address.
Well, I just had a late afternoon and got myself here, but I'm glad to be here. Thanks for having me.
Well, good. Listen, you are Eric Hall,
Yes,
and you
ma'am.
were with
Hall Comprehensive Dentistry.
Comprehensive Dentistry. And where is that located?
We are across from River North on Arkwright Road, 4104 Arkwright Road, and we've been there for about almost 20 years now.
Well, that's great. Now let's talk about something with dentistry. Why is it important that you take care of your teeth?
Well, I feel like your oral health in your mouth is kind of a window into your overall health. And so a lot of what you see in the mouth is an indicator of how well someone's taking care of their overall body. And so, of course, there's a lot of correlations between the mouth and the heart.
Okay.
And bacteria in the mouth can certainly travel to other areas and to different organs. And we see that it can go to artificial joints and cause damage. And there's just a lot of correlation between your oral health and your overall health. And we're kind of beginning gatekeepers as far as trying to identify any things that we may see.
So you can, when you examining a person and you lift up their tongue and you see stuff, you could tell if they got a disease in their body or something?
Many times you can you can see early signs of certain systemic issues.
Okay.
For example, there's one thing with like leukemia. One thing, the first signs that one may see is leukemic infiltrate. And so the gums will have a certain look to them that is, it's not a periodontal issue or a gingivitis type of thing. It's more of a systemic issue, but many times that can be the first sign that one may have something, and you see that and you say, you may want to go see your physician and get some blood work done. And so many times other issues you see with like with missing teeth, there's correlation between the amount of teeth that one's missing and with Alzheimer's or dementia. And so it's one incentive to keeping your teeth is keeping your sanity. And that we see that there's the more teeth that one loses, the more likelihood that you can have issues as far as Alzheimer's or dementia. And so that's one of many diseases that will sometimes manifest. And other issues that you may see, lesions in the mouth, that can be a sign of a larger issue there. And so many times we may see things because patients may get their teeth cleaned more regularly than they may go to their physician. So many times we may be able to catch something early that can later on, be diagnosed and then treated before something like cancer gets more aggressive.
It's a good news. I mean, I didn't know all of this, even though I get my teeth cleaned every 6 months, something like that. What about with children? Do you all see children there? And what age should parents start bringing their children to the dentist?
That's a good question. I tell patients that as soon as they have teeth, they should be seeing a dentist. At least their initial primary teeth, those first 20 that come in, at around 3 years old is when we recommend at least having an evaluation. And we see patients as early as 2 if necessary, especially if there's some sort of underlying issue or trauma or something that may have happened. And so with children, especially, it's also important to educate the parents on what's necessary for them at home. Sometimes we'll see parents who unknowingly give their children a bottle before they go to bed, and it may have something other than milk or some sugar water that ultimately they don't realize it, but it's causing rampant decay in their mouth. And so, and sometimes it can be a very surprising for a child's first visit if the parents are a bit negligent or just not knowing on what they need to be doing for their oral health. And so the sooner we can see them, the sooner we can start educating the parents and the child on making sure that they're brushing the adequate amount of time a day, and as well as making sure that there's not any unhealthy eating habits or drinking habits like candy and sugar drinks, and even sports drinks like Gatorade and Powerade. They have a lot of sugar in them. And so letting parents and patients know that just because it's not Dr. Pepper or Mountain Dew, that it still can have negative effects on your teeth. And so also the things we check for children, of course, looking for crowding, any kind of issues that can be intercepted and fixed early on, things that the orthodontist may be able to take care of. Sometimes people have a narrow palate, and so there has to be things like expanders and different appliances that we do to help facilitate the permanent teeth that start coming in so they don't have as many issues when they become a teenager. And so in the past, we used to always just see, teenagers would see the orthodontist, but now they're starting to see patients as early as first grade to start doing things like Invisalign and certain orthodontic procedures that can help while the child's still growing.
Oh, that's good news.
Many times it's easier for an orthodontist and to do a lot of the cosmetic and straightening things when someone's growing as compared to after 18 and you're done growing, the teeth don't move as fast and as easily. And so a lot of what we try to do is catch it early. Prevention is so much easier than the cure.
I know when I was little, I knocked my 2 front teeth out before they grew back. I was running to the window and I was like, ooh, they just knocked them out. So anyway, when with children and adults, when you start seeing decay in the mouth, what is that telling you?
Well, it's telling me that there's something that they're not doing correctly to begin with. Now, it's not unusual for anybody to have a cavity here or there, but we're also assessing is there what we call their caries rate. So, how much decay does one person have at a time? And if we start noticing certain trends that someone continually is getting cavities, then we can try to do some mitigate that. And there's certain toothpaste that are prescription strength that we can try to have more fluoride that will help prevent those cavities and catch it early. And that's the key. Um, but it's just one of those things that we have to try to keep them from changing their lifestyle habits. We got to see we can fix the cavity, but what is causing the cavity? So making sure that we're making the child's not eating too much candy, or an adult too, but making sure they know how to adequately floss. Are they brushing the right amount of time, which we say is 2 minutes, flossing at least once a day. But even certain things that seem like common sense, not everybody will brush every day. Some people will brush every other day or every 3 days, and you have to correct them and say, no, at least in the morning and eat once at nighttime, ideally a third time during the day. But fixing and stopping the habits that cause the cavities is the big thing for us, not just fixing the cavity and putting a filling. It's not just drill and fill. It's about lifestyle and oral hygiene habits that we're trying to fix.
That's good news. I mean, I never thought about all those things when you go to the dentist, because we are very faithful at that. Now, when you get older, sometimes the teeth, you eating steak or something, and it seems like it doesn't get out of the teeth the same way. Is it loosening there? I think.
Well, there's the expression long in the tooth. And so many times you'll hear that. And what it is over time, our teeth, they're not perfectly straight up and down. They're more conical. So as you have recession, which is those gums basically getting lower and lower on the teeth, you have more space between the teeth for stuff to get in there. And when that happens, we can have more periodontal issues that we do see in older adults. There's other issues that, like with older adults, we typically see may have bone issues. And so, say a calcium deficiency or osteoporosis, those kind of issues not only affect your bones and your skeletal structure, but your teeth as well. So if you're losing calcium from your bones and you have weak bones, you can be very likely to have teeth that are more fractured or weak and brittle. And so that can cause issues with the stability of teeth. You'll sometimes see that the bone that surrounds those teeth will slowly go down, which then can cause more mobility. But also with the gums receding, there's more space for food to get between. So when we're, say, a teenager or a 20-year-old, they may be able to get away with not flossing like they should as far as the gum health. But as we get into our 30s and 40s, if those habits stay with us, then you're going to have more issues because you're going to get more food between the teeth, and that can cause irritation. Of course, inflammation. If something sits there long enough, the gums are going to get inflamed. Once the gums are inflamed, then that chronic inflammation can cause bone loss. So something can proceed from just inflammation of the gums, which is gingivitis, to then periodontitis, which is when that bone starts going away. As the bone goes away, that's your structure that helps hold it in, and you get that looseness. And ultimately, too much bone loss will cause tooth to have to come out because it'll get too mobile. And it's just like when you have a post in the ground, if it gets loose, once it's loose, it's not going to get tight again.
Right.
There are some procedures that the gum specialist, the periodontist, can sometimes do grafting and things that can help out, give the tooth a little bit more longevity. But ultimately, once it's too far gone, the tooth comes out.
So when you're examining a patient and your people are cleaning the teeth and everything, they can tell something is wrong, or?
Very much so. So when we're checking, it may seem like the dentist just comes in there real fast and checks to make sure there's no decay, but there's multiple things we're looking at. We're first making sure there's no oral cancer in the mouth. It can be anybody who has something like that. Even people who don't have risk factors like smoking or alcohol use can still have oral cancer. So that's the first thing when we look in the mouth, is to make sure there's no abnormal lesions or anything on the palate, under the tongue, on the cheeks. And I recently had a lady who was a patient. She was 90 years old and had squamous cell cancer on her palate. Never smoked a day in her life. Never did tobacco or anything. It's just one of those things, and it happened when she was in her 90s. And so it can happen to anybody. We also see with HPV, which is the human papillomavirus that is out there, there is a vaccine, but because of that virus, there has been more incidence of oral cancer that we're also seeing in young people. And so that HPV virus not only can cause cervical cancer when females, but we're seeing more esophageal cancer and oral cancer strictly from this virus. And so that's one thing that we're seeing actually more of in dentistry. So we're looking at that. We're also, of course, making sure there's no cavities, but as far as with the gums, we're checking to see if there's bleeding. Bleeding is not normal. And so if someone has gums that bleed when we probe, we're measuring the distance from the gums to the bone. And so everybody has a certain pocketing that's normal. When it starts getting deeper and deeper, then the gums start to bleed. And that bleeding is the first sign of gums not being as ideally healthy as they should be. And we're checking, the hygienist will check the gums and make sure that that's healthy as well. And so we're measuring to see, how much recession one has had, but also how much inflammation and the bleeding. And that's the first sign that will show us. And so every time in your chart and any other patient charts, we have these measurements. So that way we get a baseline, and then we can see over the years how Evelyn Reid's gums are doing, and we can measure that.
Oh, wow, they're doing fine.
You have beautiful, amazing teeth, and
Thank you.
and
Thank you.
it's 80% of what you have. Is all what one does at home. The dentist, and we may see you twice a year. He can clean things, and there's certainly things that we can get because you can only brush your teeth so much, and you got to have the hygienist get that buildup off the teeth. But for patients, it's really what they're doing at home, and us in trying to making sure that if something's not right, that we're educating them so they can take it home and implement that and get things back to health.
So if you discover something like HPV, is that what you said? HPV. If you discover that, do you treat that, or you send them to a doctor?
Mm-hmm. Well, we have what we typically would do. You would refer to the oral surgeon, and the oral surgeon would be the one. Like sometimes we do biopsies, but typically because the oral surgeon who would be the one to remove if it is a cancerous area, we refer that to them. And also part of that is they're going to get that sample and send it to a oral pathologist who will then give you the diagnosis on what it is. Many think, most times what we may see in the mouth, it might be something that's benign, some dysplasia, an overgrowth of cells, but other times it could be something like squamous cell carcinoma or melanoma, and things that have a much more profound impact on one's life after being diagnosed. And so certainly anything like melanoma is a life changer. And so you're looking out for any pigment changes or anything like that. But me personally, I would refer that to the oral surgeon, and because they would be the ones who actually have to remove it, and let them be the ones who have to tell them the news, and then because they can tell them about what treatment is necessary after.
Most people don't realize so much goes into the dentistry field and the things that can happen to you. Do you all do schools? Because I'm sure the students don't know this, at the schools and at churches and stuff. And and people come up with so many diseases, and they don't even realize, well, it has to do with my teeth or something that's going on in my teeth.
Right. and it's necessary for that education, especially starting as early as possible. Many times, there are certain, especially pediatric dentists, that will have a van or a kind of like a bus that they will travel from school to school, especially for identifying, say, low income children who may not ever go to a dentist. I've had patients who are in their 20s and they've never went to a dentist in their entire life. And so they do have the pediatric dentist who will go in the van, and then they will check out the teeth, do a more simple exam, but at least make sure there's nothing underlying that's going to make the child have a bad toothache or something that can potentially put them in the hospital. Also, I don't, if when you were a kid, do you remember chewing up a little purple tablet, and then it would show the kids where all the plaque is on the teeth?
Yeah.
So it kind of gives them, they can see how well or how unsatisfactory they are brushing, and it shows the children where they have plaque, where they need to work on that. But that's one thing that they'll do for them. But also they'll many times place some fluoride on the teeth, and so fluoride becoming a bit of it can be a polarizing topic, but it's one thing that we know that helps prevent cavities in teeth. And so it's something that we certainly with children, we try to prevent as many cavities as possible. So you'll see that children, adolescents, and then your elderly population are going to be the most susceptible to having cavities. And so getting in there early and catching these things before, or at least fixing them before they give them pain, infection, or have to be taken out. You hate to have to take a tooth out on a child, even if it's a baby tooth. Our teeth are there to help. The baby teeth are there to help hold space before the permanent teeth come in. So sometimes if you pull a tooth too early, that can cause issues later on with the permanent teeth as far as crowding, and then that would mean they would have more issues as far as having to have orthodontics later. And so yes, the key is getting into the school, and especially first grade, second grade, third grade, and really teaching and educating these children. It's not easy.
I know dealing with kids and hygiene is something else. It's like, whoa.
Right.
But the learning about their teeth and how important it is that they know before they get to the stage of dementia or Alzheimer's. Now, let's deal with the Alzheimer's. When you have an older parent and they're having problems with their teeth, that could be a sign that something else is going on.
Well, certainly there's correlations there between that, and studies have just shown that maybe their lack of oral health means their lack of other issues, but that when you're not taking care of your teeth and you're losing teeth, you're more likely to potentially have issues with dementia, and specifically Alzheimer's disease. And so it's one thing that you can't. Well, typically with Alzheimer's, you're going to see a drop in their oral hygiene naturally, because they're not remembering to do things correctly. They're not remembering when they're not on a routine. And so things can go south very quickly, especially we see patients who are in like a memory care facility.
Oh, yeah.
They don't always have the best, they're not taken care of, and there's only so much care in the facility to help them. And so unless you have a child, or one who's coming in and helping their parent and doing the things doing a little extra, you will see that the hygiene is fairly poor.
Now, do you all deal with implants?
We do. Today, implants is pretty much a standard of care in dentistry. And so in the 1980s, it really started being introduced as more commonplace. And then by the 90s, it was pretty normal. And so today it's your first option for replacing a missing tooth. And basically there's three ways one can replace a tooth. The best one being an implant. The second, there's an option of a bridge, which is a fixed bridge, which connects to the adjacent teeth. And the third option is a partial. And so they all have their pluses and minuses, but most people want something permanent. With implants, it's a great option because you don't have to prep. If you drill on the natural teeth that are adjacent to the missing space, you can place the implant in the bone. And implants are like the root of a tooth, but they're made of titanium. And we have found that titanium is a very biocompatible metal in the body. It's the same thing that we put in our knees and hips, and the body grows bone around it. And so that makes for a great base to help hold a crown. And so implants can be used to either replace a single tooth and place the implant in the bone, and then later on put a crown that's cemented onto that with an abutment that sticks out of the gums. Or if someone, say, has dentures, one can have a few implants, be it 2 or 4, and have a denture which will click on. And anybody who's had dentures, especially a lower denture, knows that it's very difficult, and they move around, they're uncomfortable. People worry about them falling out of their mouth. And so something like implants gives it the stability and retention they need to stay in. It makes a huge difference in the quality of their chewing and what they can chew. Many times people are limited when you have a denture. You can't bite into an apple necessarily or eat corn on the cob. I mean, certain foods you really can't eat, or you have to cut them into very small pieces and chew it a lot. And so implants were a real game changer in dentistry because it gave you another option, a very aesthetic option, but a very comfortable option for patients to replace teeth, be it either all their teeth. One can have a mouthful of implants, and
does it hurt?
Well, it hurts only as much as
when you do it.
When you have to do it, you numbed up. So typically I tell patients that like having a tooth pulled is about as much discomfort as you would feel like with an implant, and it's more just a little soreness post-operatively. But the procedure itself, because one's numbed up, there's no pain involved in actually placing the implant. It's just you have to. It is a surgical procedure, so it does take a little bit of healing afterwards. And so something we give antibiotics and usually some type of pain medicine to help out the day of. But most patients tell me the day after their implant, they're back to normal.
Oh, that's great. That's great. You see so much and you hear so much, but you don't really know what to do with all of this. Now let's talk about flossing for a minute. When you floss, what are you actually doing? Taking stuff out of the gum area or what?
With flossing, you're literally removing some of the plaque that's between the teeth.
Okay.
And the way that when people brush, they get on the tops and the sides, but the tight contacts between the teeth where they abut against each other, you can't get the toothbrush in that area. And so also you're getting the floss down the side of the tooth and kind of taking it down the neck where it kind of constricts down. And so you don't want to necessarily just pop the floss in and out between the teeth. More so you want to use the floss to kind of go down the side of one side of the tooth and then go down the side of the other tooth. So you're physically removing the plaque between the teeth where the brush may not be able to get to. And many times the fillings that we ended up doing on patients where they get cavities is between the teeth. They do a great job brushing the tops of them in the front, and but it's where it's the lack of flossing that you'll see. That's where the cavities will form, and many times that's where we have to do a lot of the work there between the teeth. And so the key is doing anything you can to get the food out from between the teeth. Some people like the string floss. Some people have the little plackers with a little string between it. I tell patients whatever you can do to keep the food out between your teeth. Also now we have water picks, which are very effective. And actually I have patients who will do floss and water pick and will tell me they're amazed at what they find that water pick can get that the floss may not.
Yeah.
And so especially when patients have crowns or bridges, and even with implants, areas that may be harder to reach or get
Mhm.
underneath, a water pick is a great adjunctive device. It doesn't replace flossing, but I tell patients if you're not going to floss, at least get in there with a water pick, But
Yeah.
we recommend flossing definitely. But
Well, I have the water pick, but I want to
mhm.
talk about the best kind of toothpaste should you be using. I mean, you got so much on TV telling you this, this, and this,
Mhm.
and also a whitening of the teeth. So, what's the best toothpaste for?
Well, that's a good question. And there is so much out there, and that you have to be careful because there's a lot of marketing that's put into selling these products. And
No.
so if you go to any, Kroger dental section, you're just a plethora. And so what I tell patients, um, I recommend a fluoridated toothpaste. I like Colgate Cavity Protection. It's just the most basic one in the big red tube, and it's not overly expensive, and that's
Mhm.
all one necessarily needs. Some things may be more gimmicky when it comes to marketing that some of these companies are doing. And so they may add stuff that they may say for gum health and for whitening. And you're not going to get a lot of whitening from a toothpaste, although it will sell a lot of bottles or, tubes
Tube.
off the rack. And so, but when it comes to whitening, you can only do so much in the toothpaste. They may have something like peroxide, hydrogen peroxide, that may help out. And an old school trick that some people used to do would be mix a little baking soda with hydrogen peroxide, and by golly, it works.
I do that.
And it is effective. And so the main ingredient in our bleach when we do bleaching trays for patients is hydrogen peroxide. It's what we call carbamide peroxide, which is just a derivative of hydrogen peroxide. And so that is what is the main chemical in bleaching our teeth. And so there's different products that if one really wants to get them whiter, the most ideal would be bleaching trays that one can put the syringe of bleach in their tray and bleach as much as they would like to get it to that color.
Now you're not talking about Clorox bleach.
No, right.
Just want the audience to know.
Right. Never put Clorox bleach in your mouth. That would not be a tasty or very good on the enamel there. But yes, the bleach that we use is all it's professional grade, that it comes in a tube and it's a syringe, and it's kind of a pasty kind of, it's almost got a viscosity there that you can put in the tray and then slip it over your teeth. And we recommend patients wear it for about 30 minutes and do it daily. Try to do it at the same time of day, and you will definitely see your teeth whiten up. They do sell products over the counter like Crest White Strips, and we sell something called Opalescence Go, which are these pre-made trays that have the bleach already in it, and then you wear it, and then once you're done, you throw it away. The downside to those is once you're done, they're gone. And so you might get a little bit wider, but you have to continually buy it over and over. And they can get quite expensive after a number of applications. And so one has to make sure you're not doing things to offset the bleaching via smoking, coffee, sweet tea, Cokes and things like that can certainly offset that. But anybody can bleach, but some people's teeth have a opacity that bleaches better, or some people's teeth can just get whiter more easily. Then there's certain issues like tetracycline. If someone had tetracycline, it was an old antibiotic they used to give, and that caused people's teeth to get gray. We know now that not to do that. So you don't see that in young people, but any baby boomer who may have had that, you will see they'll have this grayness to their teeth. That will never bleach. And that's the kind of thing that one has to do, either veneers or crowns. And so
I wanted to ask you about people who grind their teeth. What do you do with that?
Well, with grinding, the first mode is making them splints, basically a type of hard night guard to keep them from grinding, because you can only grind so much before your body starts having issues. Either A, you're wearing so much enamel that you can have some sensitivity. Other times you can have something called TMJ disorder, which is the temporomandibular joint disorder. Some people call it TMD. And that can have manifests itself with a lot of pain in the joint that can radiate down the jaw. And anybody who's had these TMJ issues will tell you it's a big nuisance. But the first thing you do is make them something to wear at night, making sure that they're not clenching at nighttime. During the day, you just have to make sure someone is aware not to get
To
too
grind the teeth.
to get too tense and to be focused. You don't want your teeth, grinding against each other, because that wear and tear over one's lifetime will ultimately cause enough damage that they'll have to be crowned, or at the worst, people can break teeth and have to have them pulled.
Okay, we have about 5 more minutes, so I want you to talk about your business, how to get an appointment, what to do, phone numbers, whatever. We can talk about that.
Well, yes, we our office, like I said, is Hall Comprehensive Dentistry, and we're open Monday through Thursday. And we see all types of patients, and so we do implants, Invisalign, root canals, extractions, dentures, partials, bleaching, fillings, crowns, veneers, you name it. We try to do as much as we can for our patients, and if there's something we don't feel comfortable with or can't do, well, we can refer them. So we have great specialists around town. So, but I work with my father, who's been in dentistry almost 50 years.
And I love him too.
So he's a fantastic dentist. And, thankfully we have Fridays off. And so we work Monday through Thursday about 8 to 5:30. And, if patients need to get in touch with us, we do have a website, halldentistry.com, and patients can contact us there to make an appointment. More often than not, people call our office, which our phone number is 478-757-5455. And typically that's where they'll set that first appointment.
Give us that phone number again.
It's 478-757-5455. And Hall Dentistry, if they wanted to look up our office and just the staff and what we're about, we have some before and after pictures and just a lot of education on the website on our halldentistry.com. And so,
Wonderful. That's wonderful. I am so happy that see my teeth. I'm so happy that I found you all years ago, and it's been good to be with a dentist that knows all this stuff, because when you go, you don't know all the stuff that can be happening to you. You just don't know. But I want to ask one more question before we leave. I got about 2 minutes. With the calcium that you were talking about, what is that? Can you get too much calcium, or you don't get enough?
Well, typically most people will be lacking in that calcium, especially as we get older sometimes, or just our bone density. And so what you will see, especially as someone gets into their 80s and 90s, just as easily as they can break their bones, they will break their teeth. And so it's one thing that when one goes to your physician, they do a blood test, they're going to check these levels. And so if one's lacking in that, there's always supplements for that, but supplementing to help your bones will also help your teeth. And doing everything we can to try to keep our teeth as long as possible is key.
That's wonderful. Well, you've been listening to Issues of Life with Evelyn Reid, and today our guest has been Eric Hall from Hall Comprehensive Dentistry. And we would like you to make an appointment. If you don't have a dentist, his company is the best. I'm telling you, me and my husband and my daughter comes there, and so it's a good thing. So that's Hall Comprehensive Dentistry, and it's on Arkwright Road.
4104 Arkwright Road.
4104. You will have a blessed and wonderful Easter, and we hope that you will serve the Lord. In the name of Jesus, we pray. Have a good weekend. Bye.
Thank you for joining the Issues of Life broadcast with your host, Evelyn Reid. Be sure to tune in every Tuesday from 4:15 to 4:45 p.m. as she addresses the health, religious, and political issues that our communities face daily, right here on the Glory 107.9 FM, 980 AM, WDDO.
The views expressed on this program are not necessarily the views of the Glory 980 AM, the Glory Media Group, LLC, WDDO AM, its staff, management, or advertisers, but are the views and opinions